I want to take you on a trip down my experience with Alberta Health the last couple weeks. Oh, by the way, I'm wearing my badass shirt from Sheen and my skull earrings to go with it. But anyway, I caught a lung infection a couple weeks ago, and I was able to get my doctor on the phone right away. So by the time she called me back, it was like Saturday about 4 o'clock, and by 5 o'clock, my prescription for antibiotics and prednisone was already at the pharmacy, and so I was able to pick it up before it closed at 6. So it was a 5-day regiment. On the fourth day, which was last Tuesday, I had to go to the hospital because I wasn't able to breathe and I was kind of in a bit of distress. So 7 guys came up. So I guess some of them were fire department and then 3 ambulance guys. So I left with 3 ambulance guys. They treated me in the ambulance, took me to the hospital. Now I did have to wait a while because I was under control and I was able to wait for the doctor. So it was I guess 7-hour wait or something like that. And I was able to get up and walk around and so when I went in, the doctor was wonderful. He was like the male version of my female doctor. And so they did an x-ray and they took some tests and they determined that my lungs were clear, my heart was okay, and that's why the ambulance wanted to bring me in, because there was some irregularities, probably from the stress of all the shit. So anyway, the lung infection was something that once the antibiotics went through, I had one more day. I had to kind of like ride it out, so fine. And so they gave me more asthma meds, and so kind of overdosed on them. And then I phoned my doctor the other day and I said, it's still clearing up a bit, but still having trouble breathing. So she topped up my meds, and she also said I should get a nebulizer, so she gave me meds for a nebulizer. So I did that. So yesterday I felt like I robbed a pharmacy. I picked up, when you looked at the original bill, like what the original cost of it would be. And I'm a senior, so I have that benefit. So if I wasn't a senior, I would have had to pay probably out of pocket for it. So I'm very grateful. So the medication was like $400 and something all combined. And because she gave me a whole shit ton of inhalers as well to top up in case I needed them. And so with my seniors benefit, I think I paid $82, so bonus. And it cost me about 80 something for the nebulizer. So, and I can write that off on my taxes. Anyway, so of course, after I get this shit ton of medication, feeling a lot better today, but I've had to sleep on this couch for literally 2 weeks. Or more than 2 weeks since this happened. It's the most comfortable couch in the world, but I'm kind of tired of it. I really want my bed. Anyway, but that's my trip down to Alberta Health. Well, yes, there was a wait, but you want to know something? The ambulance ride, although if I wasn't a senior, it would have cost me money. The ambulance ride, the care in the hospital, whether I was a senior or not, was free. I didn't have to pay a goddamn thing because my taxes pay for it. So I'm grateful. The people are so stressed in there. Like oh my God, there's so many people that they have to go through. And everybody that is in the emergency ward was so sweet and friendly, and they didn't show the stress that they were feeling, and they were just wonderful. So I can't say enough about the Rocky View emergency department and the people and the staff that work there. Infinite patient. Mind you, patients were pretty well behaved. There wasn't any real assholes in there, because there could be, right? There wasn't any Karens or Kens, whoa, what about me? So everybody kind of these are the cards we're dealt with. So it's okay to wait. We're okay to wait. You got a phone, you got internet, you can watch fucking TV or whatever. Of course, I missed the last half of a hockey game for this, but still, I could watch the highlights. They had a TV in the waiting room, and it wasn't that bad. So for me, it was worse last time when I went on the pain emergency, but this time, because I wasn't in so much stress, I still had to take some of the inhalers that I had with me while I was waiting. But still, I'm grateful, and the price of free is worth the 8-hour wait. So anyway, I just thought I'd share that. Still have heavy lungs, still gonna have to sleep on the couch. Not as much shit is coming up, but still labored breathing, but a little bit better. Still taking a shit ton of meds, but you can feel that you're on your turn that corner on your way to recovery. So I've been wearing a mask everywhere. I've been walking and all that shit. So you kind of have to take care of your own health as well while you're doing it, but while you're healing. But anyway, I'm grateful to be living in Canada. I'm grateful for University of Health. I'm actually grateful for the healthcare that we have. Scared like hell for the workers because of what our provincial government's trying to do to Alberta Health. But in the meantime, it's still working. It's still there for us. And but I wouldn't go to the hospital unless you're absolutely desperate. So if you can find a way to get through whatever it is on your own. Now that I have a nebulizer, and if I get into asthma trouble now, I don't have to go to the hospital. So I can just use a nebulizer at home. So yeah, anyway, those are things that we have to do now. But and also Alberta has probably a few more people than it did back, years ago. So anyway, everybody take care. Find a way to, take charge of your own health and do the things you need to do to stay healthy. But yeah, for as far as our Canadian health system is, it's very stressed in Alberta, of course, because of the UCP, but it's also still there. My doctor is still there. The hospital is still there. So grateful for that. And anyway, just thought I'd share because that's what I've been up to the last couple weeks.